I want to thank all of you there at Maui Health for your information and the updates that you bring us every morning. All right, Dr. Weiss, we have our first question, and it says, well, I know that we have probably talked about this, maybe in parts, but can you explain to us or walk us through the COVID-19 virus? How did the virus start? How did it spread? And why is this virus more severe than other viruses we've had in the past?
This is an unusual virus, and the true name of the virus, by the way, is SARS-CoV-2. And the reason I say that is the disease is known as COVID-19, the disease is known as SARS-CoV-2, standing for Severe Acute Respiratory Syndrome related to coronavirus 2. And the virus is called COVID-19. And the virus is a zoonotic virus. It started in an animal. We don't know which one. It's theorized to be a bat. The hot zone of where it was first discovered was in Wuhan, China. There's a lot of theories about how this virus came to be. Some of them around what's called a wet market, where they sell meat that's freshly butchered from all kinds of animals. And they believe that it was a very unkempt area, and that this virus, which was an animal virus, somehow mutated and jumped and infected humans. It's called SARS-CoV-2, meaning severe acute respiratory syndrome related to CoV-2. And the reason it's CoV-2 was there was a prior coronavirus, again a zoonotic virus, that's different than this coronavirus, in 2003 and caused the SARS outbreak. That wasn't nearly as big. It involved less than 10,000 cases in the world. In February of 2020, the International Committee on the Identification of Viruses identified this as a new virus. And the reason that it's problematic is twofold. Number one, no one has ever had this virus before, and therefore there's no native immunity. People don't have immunity to this virus, and neither does anybody in the population, so there's no what's known as herd immunity, the ability to gain safety by the number of people that have been either exposed or vaccinated against the virus.
Got it.
And that's why it's so communicable, number one, because nobody's ever experienced it before and has no immunity to it, and the nature of the virus itself, because it's a respiratory virus, because it's spread by droplets that are very, very tiny and that are in our exhaled air. Even when we talk, this virus is very easily transmitted. So the combination of easy transmission and the nativity of the population having never experienced it before, it adds up to a severe problem, the likes of which we've only seen about once before in modern history, and that was in 1918. At the time of the Spanish flu. This is a very different disease, but that's the last time there was a pandemic in the world. And so, not good.
Yeah.
Lots of work to do. 3 fronts. 1, contain the virus. 2, identify and create a vaccine and widely vaccinate people to develop herd immunity. And 3, develop an effective medication that can treat people who are already affected. And I know that all 3 are happening right now. And the things that you can do, that I can do, that all the listeners can do, is prevent transmission of the virus. Wear a face mask. Socially distance. I mean, wear a face mask when you're near people, when you go into a store, when you can't be more than 6 feet away from another person, you should have a face mask on. Not so that you protect yourself from getting the virus, but you protect other people in case you're an asymptomatic carrier and transmit the virus.
That's true. I know that's why I use my mask in the stores, to prevent other people, because, that's how we have to do it. All right. Next.
That's how we have to do it. And we can make it fun, too.
Yeah, true.
Football or basketball or baseball team or college team. Go Hawaii, man.
Yeah.
Go Maui. Maui Strong could be a beautiful mask.
That's a good idea. That's a good idea.
Needs to be something that we all participate in, because if everybody masks, we're going to protect one another really, really well. This is a simple thing we all can do.
Wow. Simple but very impactful.
Absolutely, Shane.
All right. This one comes from Darren. Are individuals released from isolation those who have tested positive and are 3 days post-fever or 7 days after symptoms? Or are these individuals who tested negative? Wouldn't individuals who test positive still be carriers of the virus and still be infectious?
Two different issues. First, let's talk about the criteria by which we say a person can come out of quarantine or return to work.
Okay.
There's two different recommendations from the CDC as of late March. Recommendation number one is symptom-based. Recommendation number two is test-based. They really want us to use a test-based method, which is resolution of fever, improvement of respiratory symptoms, and 2 negative swabs 24 hours apart, and that person can be reliably released. And remember, fever is defined as a temperature greater than 100.0 or subjective fever, and resolution of fever must occur without taking Tylenol or ibuprofen.
Got it.
The symptom-based criteria are at least 3 days since resolution of fever and improvement in respiratory symptoms, and at least 7 days since the onset of symptoms. So the preferred method is the test,
Right.
resolution of symptoms and 2 negative tests 24 hours apart. Or if you can't get the tests, and tests unfortunately are still in short supply, at least 3 days since the resolution of the fever and improvement in respiratory symptoms, and 7 days since the symptoms started.
Awesome. I'm
Now, in terms of false positives and false negatives,
Yeah.
and can a certain person who was positive still shed? The answer is if you test positive, you can spread the virus.
okay.
Period. And that's why we're recommending people wear masks. Because when you wear a mask, you prevent what's known as the vapor cloud. That's how the virus is transmitted. And even if you don't know you have the virus, which is certainly possible, you're an asymptomatic carrier, that mask will prevent you from transmitting it to another person. So does social distancing, by the way.
Well, that's why we've put in all of these guidelines in place, because they are the front line on curbing the COVID-19 virus. Let's
This
see.
is the community spirit of
Yeah.
everybody chipping in and doing it.
Yeah. And you know, Ali, we have seen people comply, and it is very encouraging to see Maui, getting behind it. Of course, we want everyone behind it. And I'm personally not seeing some people use their masks. And, if you don't use your mask, you kind of stick out in the store.
I'm also noticing in stores how cooperative people are with one another, giving people a little distance. I've even seen people remind people, oh, your mask is not quite on. And so people are reaching out and helping one another. This is where Maui really shines.
This is what Maui Strong is all about, right, Lee?
That's absolutely right, Shane.
Well, let's encourage our listeners like we do every morning to stay within the guidelines and keep it right here on 93.5 for more updates. Dr. Lee Weiss, thank you so much. Always a great pleasure talking with you, and keep that head shiny, okay?
Absolutely, Shane. Regards to all the listeners. Stay healthy.
Yes.
Stay safe. Keep your families healthy. Stay safe. We're here for you in the emergency department 24/7, 365, and keep that Maui strong.
Yes, indeed. Thank you, Dr. Weiss. We'll talk again. Have a great day.
Thanks, Jane.
Aloha.
Aloha.